And with the high number of deaths as well, recently we just reported that a number of funerals could not take the cremation anymore because, like what you reported yesterday, where if you cremate like many cases in one day, the furnaces may not be able to take it anymore. And recently, the Thammasat University Hospital has rented 2 refrigerated shipping containers to be used to chill the corpse of COVID-19 victims because the existing mortuaries do not have the capacity to handle the increasing number of people dying from COVID-19 as well as other causes. A post on the hospital's Facebook page indicated that it was reluctant to tell the public about the overcrowded mortuaries, but it has to tell the truth about the problem now and in a foreseeable future, so all sectors of society can brace for a worst case scenario in Thailand's healthcare system. The post said that the hospital's forensic science unit has the responsibility for Pathum Thani province and its vicinities and is therefore duty bound to examine victims who die at home or in road accidents in its area of responsibility to determine the cause of death, adding that the number of people dying, including from COVID-19, is steadily increasing and will soon overwhelm the hospital's current mortuary facilities. Associate Professor Dr. Purahato Udom, director of the hospital, told Thai PBS that the mortuary normally accommodates 2 to 3 cadavers of those who die at the hospital, 2 to 3 of those who die in road accidents, and others from several central provinces. He disclosed that the hospital is treating 70 to 100 COVID inpatients on a daily basis, and of these, 2 or 3 pass away every day. He said that normally relatives of the dead are required to collect the bodies within 24 hours of death, but since the COVID-19 outbreak, many may be in quarantine and unable to arrange for collection of the deceased family member for several days, resulting in the hospital having to store them for 3 to 5 days. Dr. Purahat said the 2 refrigerated shipping containers each have a capacity to store 15 cadavers and are expected to be delivered in the next few days. Currently, 79 COVID-19 patients are being treated at the hospital, including 34 severe cases in the ICU, while 307 others are undergoing treatment at its field hospitals. Expressing grave concern over the worsening pandemic situation, Dr. Purahat said he expects more deaths and for new infections to soar to more than 10,000 cases a day if the pandemic is not effectively contained. Several temples in Bangkok have also complained that their crematories are cracking because of the heat caused by the continuous cremation of an increasing number of victims of COVID-19. And there is a broken crematory at Wat Kanal Temple in Nonthaburi, which is being repaired and will resume operation this Sunday. The repairs follow the House Speaker Chua Lik Phai's petition to Prime Minister Prayut Chan-o-cha for a budget to fix and maintain the crematory, as many more COVID-19 victims are awaiting cremation. And this is according to Chuan's Secretary Somboon Uthaiviengkul, who is also calling on the government to accelerate vaccination of undertakers, Buddhist monks, and rescue foundation staff who handle the bodies of COVID-19 victims.